Join HealthClick on an educational journey to enhance functional gait.
So we're going to dive right into Gait. When I start analyzing Gait, you don't have to do it exactly the same way that I do it. So the big thing is that you choose the way that you do it, and you do it that way every time.
Restoring Functional Gait is an evidence-based course developed to enhance your problem-solving skills with gait-related issues.
So at initial contact, say the right foot is contacting. At initial contact, the lower trunk and pelvis are going to be rotated forward, and that's going to be in the transverse plane.
Our proprietary 3D animations and images reinforce the learning experience when analyzing normal and abnormal gait patterns. Learn essential information to identify and treat the underlying factors that contribute to dysfunctional gait. An in-depth analysis of contributing factors provide the foundation for developing appropriate treatments for a variety of diagnoses, such as Parkinson's, lymphedema, burst fracture, spinal tumor, stroke, fibromyalgia, upper extremity subluxation, and musculoskeletal damage due to chemo and radiation side effects. The ability to differentiate musculoskeletal dysfunction is enhanced with multi-camera angles during the gait cycle. Explore evidence from both a podiatrist and general surgeon regarding the importance of identifying comorbidities that impact gait and function.
Functional orthotics are very expensive. If you get custom-made ones, they do have some advantages. However, when you look at the research done on custom orthotics versus pre-made orthotics, we find that they essentially function about the same.
Gain the confidence and knowledge necessary to diagnose and implement successful, individualized treatment programs from information provided by patients presenting with multiple diagnoses.